Hey guys, today I'm going to demonstrate the effects of the drugs on the isolated frog heart on the tutorial mode. So effects of the drugs on the isolated heart of the frog. So introduction must be here. Many drugs, before that let me click on this is the heart. So isolated frog heart. Go for the tutorial mode. So you can see here the setup. So if you see the introduction, many drugs act on the heart, like adrenergic and cholinergic drugs produce opposite effects on it. Then these drugs act through respective receptors. So some drugs act directly on the heart. This experiment demonstrates the effects of a few drugs like agonist, antagonist, calcium and potassium on the isolated frog heart. So what are the requirements we need to perform it? Here we need large size frog heart. You can see here the heart is beating, and a Starling's lever stand. This is a stand. Then what's running here is a chromograph with a drum and smoked paper or physiograph with chart recorder. So we need a heart, then a Starling's levers, we need stand, then ringer lactate saline, then a chromograph paper. Then we need a drug and solution. So what are the drugs? So let us see. You can see here the list of the drugs. We have epinephrine, norepinephrine, isoprenaline, calcium chloride, propranolol, acetylcholine, potassium chloride and atropine sulfate. So these are the drugs which we are going to use or test on this frog heart. So setup. So how to set up? Here a frog which is pit and dissected to expose the heart. You can see sinus venous is cannulated using a glass cannula and secured with thread. Then the heart is isolated along with the cannula and perfused with ringer through the sinus venous. A curved needle. Here a curved needle is inserted in the apex and attached to a, you can see the curved needle which is attached to a heart lever for recording contractions on a smoke paper pasted over the drum of a chromograph. Then the drugs which we have here, that could be injected one by one into the ringer piercing the rubber tube here, and contractions are recorded on the chart. The heart rate, that's beats per minute, is counted and noted on the chart. So drug administration is also marked. Then the tutorial mode. So what is the aim here? To find out the actions of certain drugs on the isolated heart preparation of a frog, like your adrenergic, anti-adrenergic, cholinergic and anticholinergic drugs with that calcium and potassium. So what is the procedure? How to perform it? So first thing, inject the drug one by one, absorb the following before and after the administration, right? So parameters we have to see is force of contraction in that amplitude, whether it's normal, increased or decreased. Again tone, that's normal, increased or decreased. Again for we have to look for heart rate, beats per minute. So parameters A and B means force of contraction and tone, which is assessed by observing the recording. The amplitude of contractions reflect the force. So shifting the midpoint of systolic and diastolic contractions indicate the change in tone. The above parameters must be recorded in a sheet or a record book. So what are the precautions? So everywhere, wherever we are going to perform these procedures, whatever, rabbit eye or frog heart or dog's blood pressure, we have to take the precautions. So here what are the precautions we should take is, so first thing, we have to wait till the contractions appear on the chart before administering the drugs. Again, give sufficient time for the heart to recover between drug administration. Again, always note the parameter readings before and after giving the drugs. So the main thing is you cannot mix two drugs and inject. The drug should be given one by one. So when the drug is given, its level is displaced here in this empty box. After administering the drug, you can see the blue bars. We can see later. So this gives a true indication of when the action of the drug that ends. So if the next drug is given before the action of current drug is over, the interactions can be seen. So please note, the interactions between the agonist and antagonist can be absorbed. So however, the potentiation between adrenergic drug may not be seen clearly. So the doses are fixed. Here the doses are fixed. Do not give a drug repeatedly in order to increase the dose. So let's start the procedure. As we have frog heart, stand, starling's liver, Ringo saline, and we have list of drugs, and dose is fixed, no need to change again and again. Let's begin. So here I'm going to click on the drug. So first drug I'm going to select is epinephrine. Click on inject. So you can see here the blue bars until it gets vanished. That means how long the drug action. So if it's get vanished once, the chronograph means baseline started again. So stop. So you can see here the heart rate is increased, amplitude is increased, tone remains the same. So epinephrine acts on the beta 2 receptor of the heart and increases the contraction. So we know well epinephrine is and norepinephrine are two neurotransmitters that also serve as hormones, and they belong to a class of compounds known as catecholamines. So chemically, epinephrine and norepinephrine are very similar. However, epinephrine works on both alpha and beta receptor, while norepinephrine only works on the alpha receptor. So alpha receptor are only found in the arteries, beta receptors are in the heart and the lungs and arteries and skeletal muscles. Epinephrine, also called adrenaline, which has a powerful effect on the body, so which include like increased blood sugar level, increased heart rate, increased contractility, relaxation of the smooth muscle in the airways to improve the breathing. Again, these effects are designed to provide your body with extra energy. When you are very stressed or afraid, your body releases epinephrine. This is known as a fight or flight response. So what we have observed here, that is heart rate is increased, amplitude is increased, again tone is remains same with the epinephrine. So let me select the next drug, that is norepinephrine. Click on that, inject. Watch here these blue bars until it gets vanished. So once it's get vanished, the baseline will start. So it has been disappeared. You can see here the baseline started again. So click on the stop to observe. So norepinephrine, here the heart rate slightly decreased, amplitude is increased, tone is also increased. Norepinephrine act on the alpha receptor of the blood vessels and decreases blood pressure with intense causes bradycardia. So norepinephrine, also called noradrenaline, which has effects similar to the epinephrine, such as increased blood sugar level, increased heart rate, increased contractions. So norepinephrine is a cardiac stimulant. This initially causes increase in heart rate followed by decrease in heart rate due to the reflex bradycardia with slight increase in the force of contraction. So what we have observed, heart rate is slightly decreased, amplitude is increased, and tone is also increased. So let's go for another drug, that is isoprenaline, inject. So dose is fixed, no need to change. Watch this blue bars, how long the drug is acting. You can see the heart, how it's beating here. So drug effect has been, and click on the stop. Right. So isoprenaline, here heart rate is increased, amplitude is increased, tone is also increased. So supraadrenaline acts on the beta receptor or increases in the heart rate. So we know well supraadrenaline is a non-selective beta adrenergic agonist. It has positive inotropic and chronotropic effect, increasing cardiac output by increasing the heart rate and cardiac contractility. So supraadrenaline also decreases diastolic blood pressure by lowering peripheral vascular resistance. So on administration, what happened? Increases the heart rate and force of the contraction. So let me select another drug, that is calcium chloride. Click on the inject. You can watch how long the drug is acting. Once it's disappeared, baseline will start. Click on the stop. So observe here, heart rate is decreased, right? Amplitude is decreased. Again, here tone is increased. Calcium chloride causes increase in intramuscular calcium, which leads to systolic arrest. This is upward shift. So more depolarization. This upward shift means systolic arrest. So we know calcium particles into the heart muscles during each heartbeat and contribute to the electrical signals that coordinates the heart function. Calcium particles also bind to the machinery, which is the cell, that helps the cell to squeeze together, that means contract, which makes heart pump the blood. Let me select the another drug, that is propranolol. Click on the inject. So watch here these blue bars, how long the drug is acting. Once it's disappeared, the baseline again started. Click on the stop. So when you observe, the heart rate is decreased, amplitude is also decreased, tone is also decreased. So propranolol is a non-selective beta blocker which blocks the beta receptor and decreases the heart rate. Propranolol is a non-selective beta receptor antagonist. It competes with sympathomimetic neurotransmitter for binding to receptor, so which inhibits sympathetic stimulation of the heart. Propranolol shows slow down your heart rate and makes it easier for your heart to pump blood around your body. It's usually prescribed for high blood pressure and other heart problems. Right? So let me click on another drug, that's acetylcholine. Click on inject. So was this blue bars? So drug action is decreased. So baseline, it has been started. Click on the stop to observe. Acetylcholine here, heart rate is decreased, amplitude is also decreased, tone remains the same. Acetylcholine is a cholinergic drug and acts in the muscarinic receptors and decreases the heart rate. So we know well, acetylcholine released by parasympathetic nerves, which regulates the minute to minute changes in the heart rate and contractility required for proper cardiovascular function via muscarinic receptors, opposing the activity of the sympathetic nervous system. So acetylcholine shows the heart rate by activating the M2 muscarinic receptor, that in turn opens the acetylcholine activated potassium channel to show the firing of the CNS node. So let's go for another drug, that's a potassium chloride. Click on inject. So drug action has been decreased, that means concentration. So click on the stop to observe. Here heart rate is decreased, can you see? Heart rate is decreased, amplitude is also decreased, again tone is also decreased. So it causes increase in intramuscular potassium and causes hyperpolarization and decreases in the heart rate. So everything has been decreased, heart rate, amplitude and tone. So let's go for another drug, that is atropine sulfate. Click on inject. After injecting the drug, what you have to do? You have to watch how long the drug is acting. Action of the drug. Once it's disappeared, you can see the baseline. So once it's started, you click on the stop to observe. Right? Here, heart rate is slightly increased, amplitude is same, and tone remains the same. So whenever atropine is anti-muscarinic drug and inhibits the muscarinic receptor and causes slight increase in the heart rate. So the use of atropine is in cardiovascular disorders is mainly in management of patients with bradycardia. Atropine increases the heart rate and improves the atrioventricular conduction by blocking the parasympathetic influences on the heart. So these are the actions of the drug on the isolated frog heart. So what was the aim? To find out the actions of certain drugs, mainly adrenergic, antiadrenergic, cholinergic, anticholinergic, with that potassium and calcium. So this is how you are going to perform this drug. So one more thing, as I said before, you have to remember dose is fixed, right? And you should not inject two drugs simultaneously or concurrently. If it happens, it leads to interactions. So heart, lactate, Starling's liver, this is the baseline, this here, how long the drug is acting, dose is fixed, and these are the list of drugs, right? So once this finished, so this is the effects of various drugs. So you have to tabulate all this with your graph and tabulate all your observation in your table, and have to write the graph of the heart rate, amplitude, force of contraction, tone, and inference also, and ensure for the answer for the questions whatever given to you. So if you click on the table, you may get the table here where serial number, drug, and heart rate, that's beats per minute, amplitude, and tone. So how you have to write whether it's normal, increase, or decrease. Same. Tone also same. So once it's finished, click on return. Yes. And exit. So, thank you so much.